how do we compare the conventional, traditional treatment for depression versus psychedelics? I think that's very important to talk about, because nowadays the paradigm of care is shifting and it's changing. And what we were feeling, many of the newer physicians or people who have started working in the last decade, is that sometimes we feel a little bit limited with the treatments that we have for depression. Psychiatrists sometimes are kind of like encouraged to practice in a way that they focus primarily on psychopharmacology, but we see the limitations of the psychopharmacological agents that we have. We see that people usually get better for a while, but after a while we don't see much improvement, and we get more and more patients who have tried different agents and different combinations, and they still feel that their depressive symptoms are not alleviated. Sometimes we say, well, are we maximizing other treatments that we had before, even from Hippocrates times? Like, are we encouraging people to have a healthy diet, doing physical activity? Are we encouraging that as clinicians? Are we encouraging that in society? I mean, that's a question that would be a debate that we need to have, rather than relying on the easiest thing is to take a pill, a number of combinations and pills. And sometimes some clinicians would say, well, if you don't respond to one or two pills, then your depression is more severe, but you're not even considering other lifestyle changes and alternative holistic treatments without side effects. So that's something to first think about before you go to alternative treatment. So psychedelics and some treatments such as transcranial magnetic stimulation come out as the new treatments for depression. So we have neuromodulation, and then we have psychedelics. And they are fundamentally different, but in a way they are similar as well. Because, for example, when a person does neuromodulation, it sounds like transcranial magnetic stimulation comes out as like a new treatment, but that treatment is connected to ECT, which is before psychopharmacology. Electroconvulsive therapy exists since 1938. That's before the psychopharmacological agents. And then when somebody talks about psychedelics, we'll say, well, that's completely different, but psychedelics have been consensus things, and that was proposed already in the 50s, 60s, but consensus says they are serotonin agonists. So if you're giving a serotonin agonist, you're using similar mechanisms that you would use in the conventional antidepressants as well. But psychedelics offers a new opportunity, which is something that is fundamentally different from the treatments that we had before. In psychiatry, and patients as well were worried or concerned about taking neurochemicals, because they were worried that their personality was going to change, that we were going to turn them into a different person. They wanted to be the same person without the suffering. Psychedelics are completely the opposite to that. Psychedelics are meant to change your consciousness, to expand your consciousness, and you may come as the same person, but as a new person at the same time. So that's different from what we have been trying to do in psychiatry for a long time. In psychiatry, we were trying to keep you exactly the same, but alleviate your symptoms of depression. With psychedelics now, we are telling you, it's okay to change. It's okay to think different. It's okay to challenge who you have been for all your life. It's okay to realize that maybe you were not that person and now you're a new person. It's okay to expand consciousness. It's okay to change your beliefs. And that can be very healing, but it can be at the same time very challenging. And that's where psychedelics kick in. They kick in as an alternative treatment. They kick in as an adjuvant treatment. They kick in as another possibility that we can offer, but also they come out as a possible, completely radical way of thinking differently about the way we think about psychiatry and the way patients should be handled or treated.